told you earlier, a group of students at WT White High School are being tested for tuberculosis today. This after two brothers at the North Dallas school were diagnosed with the infectious disease. They're not believed to be contagious, and today's screening is out of an abundance of caution, but it does have some of us asking questions today. So we asked Dr. Amanda Evans, a pediatric infectious disease physician at Children's Health, to join us today. Dr. Evans, thank you so much for being here.
You're welcome.
A lot of us think that TB is a disease of the past. How common is it, and why should we be aware of it?
It's not as common as the common cold, but it is something that we do see here in Dallas. It is actually one of the top diagnoses that we see in our infectious disease clinic at Children's.
And what kind of complications may we see from it?
We can see most commonly is a complex pneumonia, so it infects the lungs. It can also spread to any other part of the body.
And when is it contagious? What are some of the symptoms that we should be looking out for?
Most often children don't show any symptoms at all, so they can have no symptoms. That's the form called latent tuberculosis infection. If they have tuberculosis disease, then they'll show signs such as chronic cough for 3 weeks, fever, night sweats, and sometimes they can have other symptoms when it infects other parts of the body.
So we know that this is airborne, but how exactly can it spread?
When somebody's breathing or coughing with somebody in the same area, often we see infection with somebody in the household, or if they're living or breathing in that same space for a long period of time, then they can get infected. Often young children are particularly at risk.
And there's a TB vaccine, but you said that it's not used in the U.S. at all. Why is that?
It's not really effective, especially in preventing somebody from getting tuberculosis. So in the U.S., our public health has chosen to find people that are infected with tuberculosis and treat those people with antibiotics to prevent it from spreading further.
Following the news out of North Dallas, I know parents might be wondering, when is this disease contagious?
It's typically contagious from somebody that has infection of the lungs and is coughing. And so if somebody has that latent or that infection that has no symptoms, if their chest x-ray has no findings on it, then they're not contagious. If somebody has disease and is on medications, then they're not contagious.
Okay, good information to know. Dr. Evans, thank you so much for clarifying all of it for us. We appreciate it.
You're welcome.
Ken?
Yeah.